Your low back or neck pain may be caused by something you have never even heard of, anterolisthesis. This is a condition that is characterized by one vertebrae slipping forward on another one. And it may be something that you're suffering from that you don't even know. You see, many people don't know that they have an anterolisthesis unless they have some form of pain that causes them to go to the doctor, and then they get an X-ray image which reveals the anterolisthesis. In fact, I didn't know I had an anterolisthesis. When I was getting my PhD in orthopedic manual physical therapy, we were required to go get full spinal X-rays. We use this, one, to learn how to read X-rays, but we also use this, two, because we were doing advanced spinal manipulation, and we needed to make sure it was going to be safe. So I had no history of low back pain. I mean, yeah, I'd had low back pain here and there intermittently, but nothing that lasted more than a week. And literally had no clue that I had an anterolisthesis until I looked at my X-rays. In fact, it was really interesting because what we did was put the X-rays up on a screen so everybody could see them, so they were really big. And I remember my professor turning and looking at me and saying, "Amy, whose X-rays are these?" Because I was using my computer to project onto the screen. And I said, "Sir, they're my X-rays." And he turned and looked at every single student in that class and looked them in the eye and said, "You will be very careful when you're manipulating her spine." So that's how I learned I had an anterolisthesis. In fact, that X-ray showed that I had multiple issues with my spine, but that's another story for another day. So if you have an anterolisthesis, what are some of the common symptoms that you'll see? First, you will usually have pain, and it will usually be pretty close to the spine and in a very localized area. It's one of those pains that in general you can put one finger on and say that's where it starts from. Two, you'll have muscle spasm around that area because the body's trying to hold that anterolisthesis in place so it doesn't slip forward anymore. Three, if that anterolisthesis has slipped forward and is putting pressure on that nerve as it comes out from the spinal cord, then you probably will have some pain, numbness, or tingling down into the affected extremity. Number four, if that numbness and tingling progresses, you may actually have difficulty with the sensation of hot and cold. Many people with an anterolisthesis have poor posture, and I gotta say in this case, it's not all of your fault, because when that vertebrae is slipped forward, you no longer have that stable base in order to create that good postural control. Now, there is things you can do about it, so don't assume that you're gonna be stuck with poor posture for the rest of your life if you have an anterolisthesis, but do understand that being careful of your posture is gonna be important for the rest of your life. And the last thing that we often see with an anterolisthesis is weakness in the affected musculature, specifically in the smaller muscles surrounding the spine that help with the posture, as well as keeping the joints from slamming down on each other. You see, when you have that anterolisthesis and one vertebrae is sliding forward on the other, it's putting a lot of tension on multiple tissues, including the disc, but also the muscles. So the big muscles are going to try to pull it back, which doesn't work. What happens is it ends up slamming everything down in that back part. Now everything's slammed down and those small muscles can't work very well at all. So in your spine, you have these muscles that are called the multifidi. They're these really, really short muscles that just span 1 to 2 segments, and they make this Christmas tree pattern that goes all the way from your neck all the way down to your low back. The challenge with these muscles are super important because they help to control joint motion or keep the joint from slamming down on itself. However, they're small muscles and they tend to turn off whenever they sense pain. So they sense pain and then they turn off, then the big muscles have to try to hold everything in place, which causes tension. The tension in the big muscles may actually compress things like the disc or the vertebrae, which can make the nerve symptoms worse. And so this is why a lot of people who have an anterolisthesis don't know it until all of these other things have come into play, because it's not necessarily that the vertebrae is slipping forward that's actually causing the pain. Most likely it's the body trying to put that vertebrae back up, but it can't because it's already slipped forward. And it's all that muscle tension and the concurrent symptoms that come along that are actually what's causing your pain. which may seem like an unimportant point to belabor at this point. However, I do think it's a really important point because many people will come in and ask me, should I have surgery to resolve my anterolisthesis? And the question I ask them, is the anterolisthesis actually the thing that's causing the pain? Or is it from the muscle, disc, ligament, nerve, joint that's being affected because of the anterolisthesis? See, if you have surgery, let's say you have a fusion and you put that anterolisthesis back on top, you still may have all of that dysfunction in all of those other tissues. In addition to the fact that now you've had surgery, so now you're going to have scar tissue, which is putting increased stress on all those other tissues. The surgeon will say that the surgery is a success because he put the vertebrae back on top. And I agree, he did. However, what was the effect to the other tissues that are present? So this is really important to consider and make sure that you're working with a specialist who can help you understand if it is only the anterolisthesis that's causing your pain or if it's all of these other issues which may be able to be resolved with more conservative treatment. All right, so if you've already been diagnosed with an anterolisthesis, or even if you believe after watching this that this may be what's affecting you, what can you do? The first thing I want you to do is address your posture. Poor posture can actually make an anterolisthesis worse. So it's important to make sure that you are able to find the best posture for your body, including using any props, towel rolls, pillows, or anything that you need to help your body be able to maintain that position. The next thing is I need you to avoid doing the wrong exercises. Now you're going to ask me, what are the wrong exercises? And I got to tell you, every body is different. However, in general, with an anterolisthesis, any exercise where you're extending or bending backwards, if that's your neck, if your anterolisthesis is there, that's looking up towards the ceiling. If it's in your low back, it's that backward bending type motion. You need to avoid those activities because in general, that's going to put more stress on the anterolisthesis as well as the tissue surrounding it. And I can already hear you, Dr. YouTube, that there's so many people who are going to drop in the comments, well, there's other people on YouTube who recommend doing extension-based exercises for anterolisthesis. So before you drop that comment below, I just want you to think about the biomechanics of it. If you have a vertebrae that is slipped forward on the other vertebrae, and then you bend backwards, what is that going to do? I mean, just think about it for a second. This vertebrae is slipped forward and then you're bending backwards. That's going to put increased pressure on those tissues that are in the posterior aspect, which is probably going to increase your pain. And it's not going to do anything to help resolve your anterolisthesis. Now, you may have heard that you should use bracing for an anterolisthesis. Now, in general, I'm not a huge fan of bracing. However, there are some caveats. When that anterolisthesis first slips forward, for some people, it can be really painful. And if it requires a brace for you to feel supported enough for you to be able to move around and participate in daily activities, then I'm okay with using a brace. However, I would prefer you only use the brace for as long as you need to, or when you're doing higher level activities, as opposed to using it regularly every day for the rest of your life. In general, what we want is for your muscles to provide that level of support or bracing as opposed to using an artificial brace. However, sometimes you need a Band-Aid in order to help you get up and get moving. And if you feel like you need that extra support right now, I'm fine with you using a brace in the short term to help you be able to get moving. Just make sure that you only use that Band-Aid for as long as you need it. Another thing to watch out for is non-specific physical therapy. When you're working with someone who is not a specialist, they may give you exercises such as extension-based exercises, which are not good. We've already talked about that and how that can make your anterolisthesis worse. So if you are seeing a physical therapist right now who's giving you a generic sheet of exercises, and especially if they include extension-based exercises, that would not be my recommendation to continue with them, but to find a specialist who is well-versed on anterolisthesis and is willing to look at your body as a unique body to learn what needs to happen for you. And the last thing that I want you to watch out for is resting for long periods of time. Now, I will say when your symptoms are super acute and flared up and you feel very unstable, so that first 1 to 2 days, I do recommend resting and icing and not moving around a lot in general because you feel unstable. But after that initial day or two, I want you to be icing for 5 minutes every hour. I want you to be getting up every hour and at minimum walking around the house, and then you can sit down and rest some more. Because the truth of the matter is movement is life, and every tissue in your body is designed to heal itself as long as it's moving correctly. So I need you to get up and get moving as much as you can without increasing your symptoms in order to get the benefit and the pain relief you're looking for in the long term. Anterolisthesis can be a very challenging issue to manage, and I will say that it is something you're going to have to manage for the rest of your life. We want to make sure to protect the low back because we want to make sure that the anterolisthesis does not progress over time, but that will require you focusing on the things I mentioned earlier. 1 is posture. Make sure you avoid poor posture. 2, avoid the wrong exercises. 3, bracing should only be used as a Band-Aid, never as a long-term solution. 4, avoid non-specific physical therapy that's not addressing the root cause. And 5, avoid resting for more than a day or 2. And again, I realize that this is a super controversial video. I don't mean to be controversial and go against what everybody else is saying on YouTube. However, I am going to speak the truth and tell you the things that you should be avoiding as well as the things that you should be doing. I'm a specialist physical therapist with over 24 years of experience as a manual physical therapist. I have worked with multiple people with anterolisthesis as well as being a person who lives with anterolisthesis. And I want you to know the truth so you know how to cure your problem.